Can you hear me?
I should think it's fine. I'll just tell them to raise the volume of their computer as well.
All right, thank you, Shabir. So the idea was around creating a formal structure around the governance of AfroPHC that could actually look at propelling the agenda on primary healthcare, particularly within the African context, for the next foreseeable future. And this formal structural governance is supposed to be looking at having a 9-person executive board, which shall be in place for around 3 years. And then this board will be elected through the leadership, through the members of the AfroPHC. And I'm sure at this stage, all the people that are attending in here have registered and are recognized as members of AfroPHC. We then had a discussion around, in that very same meeting, on the structure of the articles of association, or how AfroPHC could look like. And through the core group, which was a smaller-ish group, such structures or such a vision of the articles of association were put together. And this has been shared again with the members of the group and has been accessible also on the AfroPHC website. And the idea for this particular meeting was for the members of this, our community, to adopt the articles of association for primary AfroPHC, and then moving forward, look at the selection of the 9-member executive board. So having said that, I wanted to first just pose a question to everybody in the team.
Perhaps I can just quickly introduce people to the platform a little bit and to help things. Just to remind people that there is in fact a translation. We're very fortunate in having a Portuguese and a French translation. So if you go to your Zoom, you should be able to see an interpretation at the bottom. Please use that if your English is challenged. We will try to keep our English slow so that the translators can do a reasonable job translating as well. Just remember to unmute yourself if you need to speak, but the chat is there available. Also, if you look on the right-hand side of the screen, you will see that there is a heart, which you can click on if you are using a Mentee, but I'll show you just now, and questions you can post. So you can post questions on the Zoom as well as on Mentee. So let me just quickly, do you want to do that before I start jumping? Anything else you'd like to talk of? I can go to...
No, please, just go ahead. Please go ahead.
All right. We just show you how to use Mentee Meter because we need to use that to adopt the articles. So if you're looking at Mentee, if you go to Mentee and download it, and I should have actually told you to do that beforehand, but if you go now and find on your phone, separate to what you're viewing, so that it is easier, is download the app Mentee. If you just look for mentee.com, you should find that quite easily. And then you will be able to enter the number, which number you will see now. So it's quite easy to work with. So the number that you will see is the one that is on the top of your screen. I made it in quite large, and we will try to put it up into the chat group so you can just copy and paste it. But just remember 4187-2985. So you use that code because that's at the top of the screen. And you can try it with questions. So we'll give you a few seconds to get in and to try it. And we're going to ask some simple questions. And I think we can just go through the questions. It's what country you are, what profession you are, and then just how you're feeling. And then we will go to the agenda, which is what's already been done in welcomes and introductions, the articles of association and the elections, as Champion has just said, and then we can go on to the articles when Champion is ready for that. So let's go back and just get people to see how they can get onto Mentee to vote. we will need to use it. So if you can just take a few seconds to get that right. I've got the code again, and we'll write it in the group 41872985. But whenever you look at the screen, you should see it right at the top. So you'll never lose sight of it. Just look at the top. Everyone who's in this meeting and a member will be able to vote. Okay. So we need people to show themselves so that we can see that this is working. So on the next question, please tell us where you're from. As I said, download Mentee. What we can do is come back in a few seconds to see how far you are. You'll have this chance to do it. It's great. Lots of people are getting in. What is your profession? We've got lots of people already beginning to get that question. And the last question is just how you feel. And then we can wait for people to come back to that a little later. So Champion, over to you.
Thank you so much.
Shall I go into the articles? You tell me when to start that.
Yes, thank you so much, Shabir. I just wanted to confirm that if the members had an opportunity to see the articles.
If you can just respond on the chat.
Colleagues, did we have an opportunity to at least see the articles? Then we can, if yes or no, we can sort of get an overview of the articles through the presentation. I see a yes. No. Okay. Okay.
Right. We can go through it, but it's important that you have a look at it. It is on the website. So if you go to the website afrophc.org and go to the workshop, you should see a link to the articles. And you can have a look at that. It's important. We have tried to provide it to people, but we will go through that. So shall I go through it?
Yes, please. I think that will be better, just to give an overview before the colleagues are expected to make a decision around the articles.
Okay, there are 5 slides, and I'm just going to go through them. The name of the organization is the African Forum for Primary Health Care, a short name AfroPHC. The objectives, as stated in the articles, is to support and advocate strong primary health care and universal health coverage in Africa, to engage in all other activities that are related to the above in the broadest sense of the term, or that be conducive to the above. How it's going to realize these objectives is by organizing meetings, publications, presentations, organizing study visits, awarding prizes or grants, and financing activities by third parties, organizing the exchange of knowledge, advocating for specific policies, and stimulating research. Sorry. So everybody can see that. Let me just put it in full screen again. So the articles continue to provide membership, which is any individual or institution by application, which is not detailed, but is by application, which will be decided by the member, the executive board. The obligations for members are an annual fee, which is 0 for now, for this year. Membership may be terminated. There may be disqualification, suspension, and also an appeal system should there be a challenge with that process. There will be general meetings, which is once a year, like we're having now, with 14 days notice for such a meeting. Voting in the meeting is by all paid up members who are valid. The voting system at the moment is individual 1 and institutional 2 votes. We are going to amend that, which is why it's highlighted in red. Decisions in meetings of the general meeting is by majority vote. The elections are by the most votes. Please feel free to add your questions. As you can see on the right-hand side, you can do that. You can also add to the Q&A on the Zoom. So feel free to add your questions and queries, and we can go and look at the actual articles themselves. So the executive board is going to comprise of 9 individuals from 5 different countries, with nominations at least 2 days before the general meeting. The executive board will designate a president and vice president from members. The executive board can also co-opt 2 additional members. There is no remuneration that the board members will receive. The duration of the executive board membership is 3 years, but there are resignations that need to be on a schedule so that there is a lot more, that there are elections every year and that there is some continuity. So the board will have to arrange that. Termination of membership of the executive board is either by dismissal or resignation. The executive board can meet as many times as need, but must meet at least 4 times a year with 2 weeks of notice. And there must be at least 2/3 of the 9 board members present for a quorum. Again, that we are suggesting an amendment after we've provided you that detail. Going on, the duties of the president is to chair meetings of the board and to present a report of the affairs of the AfroPHC at the AGM. There is an executive coordinator, which will be decided by the board, who will keep minutes of meetings, taking care of correspondence, preparing reports of the association, and managing the archives, raising of funds, financial transactions, especially including collecting money and paying debts, preparing a budget and a financial report every year. So that is the administrative type of role. There is also an advisory board of the AfroPHC, which is being set up with 5 to 30 members, which is to be established by the AGM. And we'll come back to that question. The objective of that board is to provide advice to the association and the executive board on the vision, long-term strategies, and activities of the association on request and on its own initiative. Again, the board will be for 3 years duration. Regulations will be created by the executive board to deal with more details on the functioning of AfroPHC and the board and other issues. A bylaw or articles can't deal with every instance, so regulations need to be in place to deal with details. The association's year will be from the 1st of March of 1 year to the 28th February of the following year. It is also empowered to manage financial documents, a budget, setting up committees and working groups. There is also a clause on the way in which amendments to the Constitution to these articles occur, as well as the instance of liquidation, what might happen. So these are the elements of the various questions or the various elements in it. So I think there are questions. I'm not sure if perhaps we can just go through any questions on the chat, Q&A. I see on the chat. Do you want to manage that, Champion?
Oh yeah, we can do it together. I just wanted to first appreciate it seems we're getting a lot of people agreeing or rather announcing themselves. Welcome to the meeting. We have already started. Just please note, colleagues, it's Mentee Meter, MENTI, and you can find that in your app store on your smartphones. And then from there, after that download, you can enter the code number and then you're part of the presentation. So for those that are already in the presentations, from what Shabir has presented, if we do have any questions regarding the articles, could we put them on Mentee Meter, on the chat, or also on Q&A? And these can be useful in terms of structuring the articles of association.
Okay. I think there's a question here about, are we still making the 1-minute introduction? Yes, we need to move to that fairly quickly so that we don't take too long. That is actually the centerpiece of what we're going to do today. I think the question about the advisory board, we in fact will talk to that question now, and I think we may have to add that question, is whether you will allow the executive board to first decide on approaching various organizations to support. So just to inform you that in the core committee, we felt there is a list, and I can share that shortly, of organizations that have supported the AfroPHC efforts. We want them to formally support it and to allow us to put their logos onto our website as supporting organizations. We want to be very strategic about these supporting organizations. And then what we're going to do is we're going to ask them if they would like to, and then decide first amongst ourselves, which of those supporting organizations do we feel need to be asked to be part of an advisory board. So I think that there's going to be, I think, a little bit of time required to get communication. And I think the important thing is that once an executive board is established, there is a lot more legitimacy to the organization, so that people can then respond when we ask them to support and also to stand on the advisory board. So my proposal is that we have have you to allow us to set up that advisory board. Does that seem reasonable? We'll actually just deal with that question and get you to agree with that. So I'll see that as answered. Peter, I'm not sure your difficulty, but we've just started, I think, and we have gone through the elements of the Articles of Association. So if you can look at the articles and just ask any questions. Will the 5 countries be predetermined? No, that is your decision as members to decide. So it's just a question of you trying to make that kind of decision in your voting to try and get a wide representation. And hopefully it does show up in the outcome of the election. And we will have to have that kind of discussion if there are challenges that the executive board or the core committee now will have to review the results. Champion, do you agree with that, Innocent?
Yes, I agree with that.
I think we will just see that hopefully you do it and it gets to be right, but if it's not, we will try and address that problem before validating the results. How do we marry the exec? Yeah, that sounds fine. Thanks, Innocent. The question, how to marry the activities of the executive board with that of administration. Ultimately, the executive board is responsible for anything. So what that board is going to do is appoint an administration. So either from amongst, the members of the board, or however, I think the point is that we've seen in other organizations, especially Pan-African organizations, that when you have secretaries, secretaries, treasurers, and they're in different parts of the continent, it can be very difficult to administer the organization. And it is actually from my experience with AfriPen that was a problem. And we said, let's rather have an administration that is located in one domicile and in which they can be empowered to manage that. Any comments from Champion on that? And Innocent?
I agree with you that there will need to be having a specific place where all the administration will be centered. And across the continent, there could be various issues, but if it's, for example, finances, there will be need for standardization of certain procedures and processes, and even the currency in which the deals of AfroPHC would look like. So I think this would be one of the primary tasks that the executive board needs to look at as they chart their strategic plan for AfroPHC, in becoming very specific on the location and the activities of AfroPHC.
Good. Innocent, any comments from yourself as a core committee member?
Yeah, thank you. Yeah, I really agree with the champion, but I think once the board is in place, we should be able to establish financial and accounting management procedures so that the board really is guided on how to work out administration as well as finances. And hopefully, of course, it will be a requirement that the accounts are audited so that we always report back to the general to the general meeting or general assembly.
Absolutely. I think the board needs to create regulations. And of course, as the board goes forward annually, there is a general meeting. They may in fact want to revise some of the elements of the articles. So I think that the board needs to make that decision, but the board is ultimately the decision-making body between general meetings. So they account to you as a general meeting and take it from there. So I think that hopefully does address that problem. I think how will AfroPHC communicate? I think we've been communicating as we are by email and workshops, which are very interactive. And of course, we're open to any other ways in which communication can occur. I think it's some of the issues that we would put on the agenda of the AfroPHC board. I think that would be an important one. Is the communication adequate or not? I think good. And I think thanks, Scott. We're grateful for you being here and actually, globally providing a role. I think that idea is to get some very strategic people, people like yourself who might serve in a board, but we have to, the decision must be the board's itself, the executive board or this meeting. But at this point, I think we've got to just allow the board to settle down. And then annually, I think the board can come with the revisions to the executive board. Yes, the question of subcommittees, that is entirely up to the board. The articles allow that. So I hope that's answered. Thank you for joining us. The unmute button, I think we will allow that to happen once we start the 1 minute presentations. Tactical committees, yes, in fact this is part of it, groups, etc. So I think this will be part of the ambit of the executive board. At the moment the secretariat is based in Johannesburg, and that's basically the work that I've been doing, which is South Africa. I think the board will have to review and consider what options they want to look at. Who are relevant organizations? I think this is a very important question, is that we basically wanted to make as many and any community frontline people. So, it's not just healthcare workers. At our meetings, at workshops we've said how important it is to get the voice of communities. Any comments on that from Innocent and Champion? Champion? On this question of how membership should work.
Think that I think the membership, of course, we know that we have both individual and institutional memberships, and I think both kinds of memberships fall within our main theme, which is really everyone that is involved in the frontline healthcare delivery. So everyone who is really in the PHC should actually in any way be able to be given an opportunity to be a member of AfroPHC.
Very true.
I concur and agree with Innocent that, the idea is to align with the mission and the vision of the organization. And that may be directly in PHC or in health workforce development or in partnership or in so forth. But as long as the idea is about improving the quality of primary health care and achieving universal health coverage, I think that makes it in for the organization.
Absolutely. And it can be even a community group. So it's really quite open. I think if there needs to be changes as we proceed, but right now we have a very open book to this process. So I think that's the position right now. I think the question by Hude is that there'd be no remuneration. Well, there is no remuneration. So apart from expenses, but at the moment there are no funds. So I'll be honest with you, that is something that I think anyone who's standing for this board must know, that there is no money. It's not a job. There's no board funds to provide you anything. So if you do want to remove yourself from the, from standing, please tell us. The board probably has various committees. Yes. I think there's a question here. How can A students' union, any group, Ruben, can be part of it. So, as an institutional member, you'll get that vote, as well as individual members may join it. So I think it is open. What we don't want is for an organization to try and take over, AfroPHC. So the more diverse, the more wider the participation in AfroPHC is going to be, the more powerful it is going to be for all of us as individual organizations, as individuals as well. So I think that kind of maturity of where we go forward is important. But I think any individual, any organization, as Champion says, who fulfills or works towards the objectives as we just set out is welcome in AfroPHC. I'm not sure I'm speaking English, and I wonder if we can just get some translation for some of that. And I need to get my translation working, which is not available for me. So if somebody doesn't mind just adding an English translation, I think sources of financing for the organization, I think, if I may understand the concern that might be, I think this is something that the executive board will have to look at. How does it actually find funds? There are possibilities, but we need to be able to decide on how to go about that. What are the principles on the organization? So I think agree with Colin that remuneration is a very dangerous problem. It's pro bono. So thank you, Karen, for answering Christine, for answering some of the questions on the chat group. I think let's just see if we can go through. Is there a place for medical research scientists? I think if your heart is in the place of primary health care and you are concerned about the issue, I think your location as a medical scientist is not important. I think the fact that you are interested in primary care and its functioning, I think, Joseph, this is more than enough. Adherence to the objective is then the question of board subcommittees for the executive board, Kawena, it'll be dependent on the board. So if you're on the board, it will be a question of what is needed. At the moment, we have set up groups, which we've asked you to join, which will be the beginnings of such subcommittees. We will see between the board, I think, how they feel they could manage that process. But I think we just need to know if you're interested, and from there, the board can take that process forward. I'm not sure. I think that's the same question. How can the members be involved be part of working groups? Please, when you become a member, you asked which group you'd like to be part of. If you've indicated that, once we settle down with the board, I'm sure that the board will then set up a way in which those various committees will be activated. Starting with the webinars or workshops which are being planned and are on the website. So, and yes, and I think that, Moses, as you've said, there will be committees. I think that let the executive board, I think after today, it's the executive board that must make these decisions. So thank you for that. Thank you. What is the composition of the board? It's 9 people that will be selected from 5 countries at least. In other words, diversity. But we also encourage, and it's in the bylaws, to encourage diversity of language, geography, profession, etc. So we need to try and find ways in this board to represent the diversity that exists, as well as looking at diversity of skills. So it is not about all professors. It is about what you think is important. And I think that leadership ultimately is the way in which we should be deciding. So I think that, Abdullah, I think the decision is going to be in the 1 minute, where once you see the person's capacity, I think it is more important for you to make an overall judgment. Is this person got the capacity to lead us? Sorry, I'm answering all the questions. Do you want to, Champion, do you want to try going through the chat group for me? And or and I'll just look at the question and answers as well.
Yeah, sure.
If there are any questions on the chat group that you can just pick up and try and answer them very quickly. I think
at this stage, some of the questions in the chats and also in the in Mentee were similar, and you answered them.
Yeah. Okay, so I think the composition is answered. How often the board will meet? It will be as many times as needed, but a minimum of 4. The board will make that decision. Can you tell us more about, I think these are things we don't have decisions on. Once the board sets up, then it will decide. So I think that covers us questions from the mentee. I see there's some questions coming from, so let me just stop sharing for a moment so I can see the questions there. I think languages, all languages, at the end of the day, I think there isn't an official language, but we need to cater to all languages. And I hope that you are able to listen in on the translations in French and Portuguese. And if it needs to be in Arabic as well, considering the diversity we have here, we may have to consider that. But I think that that is not spelt out in the question of the articles. I'm going to try and get Google Translate so that I can manage a few questions quickly. So the question, don't you think of a charter for the association? That's the articles. I hope, Aziz, that you're clear on that one. What are the requirements for joining? Is it for Africans only? This is an important question. At the moment, it has not been specified that it is limited to Africans only, but it is about an objective for African primary health care and universal coverage. And in our view, there are lots of international people who can join and be part of this, and who should hopefully respect, and who we see as being very respectful of the need for Africans to lead, but would like to be part of it, which is why we've addressed it like this. The executive board can still discuss this and make amendments in the next AGM. But for now, we have said it is anybody globally can be a member as long as they support the objectives. Membership fees are, Ephraim, are 0 at the moment. Benefits are basically, for now, mostly your participation in electing the executive board. I think this question of what are membership benefits will have to be discussed by the executive board as well. And I think then come forward and be more clearer. Who were the key founders of AfroPHC? That is a list of people that is on About. So if you go to the About AfroPHC on the AfroPHC website, you will see the people that have been involved, and you can see at the list at the bottom who they are. And I think it's important that we share that very quickly. So give me a few seconds, that you know who has been really behind this. Myself, Prof. Shabir Musa, David Lasale from the African Network of Associate Clinicians, Bongi Sibanda from the APA Network, Dr. Lillian Zodzo, Dr. Tembeka Gwagwa, Dr. Prosper Tumisime, Dr. Godwin Aja, Dr. Mariki de Villiers, Champion Nyoni, George Kimati, Nkechi Olalere, Francis Oanido, and Bob Mash. Not all have participated, and their roles might become more as advisory depending on how we proceed. So the people who've been mostly involved are the people on the call with Bongi Sibanda and a few others. So it's been a little bit challenging. I think the key is that we find a very active board. So I hope that you'll be an active board as we go forward. Yes, thank you. I think the advisory board is supported, and we look at how to set up these. I think the question, can government ministries, department, agency join? I think nothing stops them from joining. I think at the moment we have no limits to that membership, and in fact it might be very welcome, and we would probably encourage engagements by the AfroPHC at a country and a regional level. So it's something of an agenda item as how we get the AfroPHC not just at a African level, but happening at a local level, and finding ways for frontline healthcare workers and any stakeholder to be able to speak to other relevant stakeholders and engage them, in that discussion. The different offices, there are only two, a president and a vice president, as we presented earlier. Are we going to have appropriate representation? In fact, one of the diversity issues is going to be age. So please, in your consideration of the board, please look at the age diversity in choosing your preferred board. Since non-Africans are not numbered, will they compete for positions? I think that is something that you need to make a decision. At the moment, we have a few people who are standing who are not actually from Africa. I think you need to make that decision as, do you think that is suitable for them to provide leadership or not? And I think that you, as members, we think that you need to make a decision that is supportive of Africans to be able to lead the organization going forward. I think we welcome anybody, but we haven't limited anybody to set it up now. Again, a question for the board to be able to deal with that. Peter, your question, the different posts, it's 9 more board members. Within the board, they will in fact decide on a vice president and a vice president. WHO Afro, I think we will be asking them, it's difficult for them to join AfroPHC, but we have a very good relationship with WHO Afro, and we'll probably ask them to serve on our board, advisory board, and we know that there is a willingness to do that. So I think that deals with all the Mentee questions and the Zoom questions. The link for the articles, if you go to the front page, afrophc.org, then you will find the link to launch. If you click on that, you'll see the actual declaration. The other way to get there is to go to meetings, AfroPHC Launch, and you'll see the articles, linked to the articles there, and you can read it. I think Andrea asked the question that we have got the translations in Portuguese, and we have got a French translation. Please, if you feel you have any challenges, let us know. And if you feel it is working well, please let them know. I think they would like to, be appreciated. I think we're really battling with the budget and have not been able to pay them very much. And we really appreciate their commitment to actually assist an African exercise like this. Labram asked the questions, are there any plans for regional representation on the board? Perhaps, you could respond to that, Champion and Innocent. What do you think about that going forward?
My initial knee-jerk thought would be, I think it's an important question that should be carried forward to the board. Once the board is set up, these are the issues that they should sort of look at strategically. What is the role, what is the value, and how does regional representation actually enhance the functions of the entire board? So I think just in general that I pick that there are certain specifications that the members are raising, which are quite essential on the operations side of the board. And I think the initial step was actually to set up the board.
That's
Once
right.
we get the board going, a lot of these issues that have been raised today starts to become unpacked and present a better strategy on how we could look or move forward with the organization. So I think regional representation could be something that could be thought about. Student representation could be something that could be thought about. Yeah. But I think this is now food for thought, and it's a pedestal for which the board could start working from. Thanks.
Absolutely. Thanks, Champion. And Innocent, your thoughts on that? I think.
Thanks. My thoughts are really, I agree with the Champion, but you realize that given the circumstances we are in, we are just trying to set the base. Having a regional representation is very great, and I think that is what you should aim for. But for now, it might be very difficult. We haven't known who is who and who are we. So, but I think part of the tasks that the board that will be put in place will do is to put down a procedure on how we shall ensure regional representation. That's my view.
Yes, and I think Dr. Bajo, I think I agree. You know, it's something that regional representation will come through, country level engagements will come through. I think these are all very important. Rather, a gender balance is very important, and I think that is also part of the mix that we will have to make sure is there. And I think when we finally sort out the, validate the final results, we will try to establish that those are all in place. Thank you for all these suggestions. I think the question last, and we'll close questions now, is that our board, is the board going to be the final decision maker? Yes, between AGMs. And I think if there's clarity that's needed, direction needed, ultimately the final decision maker is going to be the members yourself. So you're the boss. And let's go forward now. I think I'll leave it over to you, Innocent. It's really, I could manage this, but I think between you and Innocent, we've got 116 participants, and what we're going to do is we ask that all the candidates who are present, please, they pick up their hands so that we can just have you much more easier available. And then I think for the purposes of the process next, it would be easiest. I think firstly we need to agree to the board, to the articles, sorry, and I think the changes. Sorry, let's just quickly do that before we do this, and I think we can just do it in a short few seconds. So if you are having any issues, please put up your hand. I think not put up your hand, let's put yes. Let me just quickly get to the Mentee so that we can just see if you are on Mentee. If that is a challenge, what we can do is just do a very quick decision, which is that you decide if you accept the articles going forward. I think before we go, let me just quickly share this. Sorry, I'm fumbling a little bit. Welcome, Bongi. Right. So going back, we basically had to agree to the articles, and we just need a vote. Unfortunately, we need you to be on Mentee. So if that's not working very well, we have got 3 amendments, and I'll go through it very quickly. And then if we can get a yes, one single vote on all of this and proceed. So the amendments that we have in the articles, since we provided it to you, we actually are changing this one, which is instead of just having individual members shall have 1 vote per membership and institutional members shall be 2 votes per membership. We want to change it to individual members shall have 1 vote per person membership and institutional members shall have 2 representatives per institutional membership with 1 vote for each representative. We were struggling how to manage people with 1 vote and 2 votes, and it was actually technically quite challenging. So we've actually making it this way, considering that we have to function electronically. The second amendment is that we also are adding this clause: for the purpose of the election of the 9-member executive board, each person voting will get 9 votes. This is just much easier and will be much more able to get diversity picked up in it. And I think that is important that we manage this electronically. So I hope that this has been useful. The third one is that the current says that the executive board may only adopt resolutions by at least 2/3 of the number of board members present or represented. We're changing it, or we are recommending a change to adopt resolutions if at least a majority and of the board members are present. And the problem is that if it is 2/3, it may become quite dysfunctional quite quickly if attendance is not there. So I think we just need everyone in their groups to be able to go and look for the reactions. I think that you are able to, and to put a indication of its acceptability. Are people able to vote on this using Mentee? Any guidance from Champion and Innocent will be welcome. I think if you can put into the chat, which is probably the easiest, if you support or not. So if you can just put it into the chat group, supported. If you support the articles and the 3 amendments, just please put supported. If you don't, then please indicate not supported. Okay. I think, okay, if you can use Mentee as well. And what we will do is we will send out a similar tool like we did for the voting to also make sure that that is supported. So thank you very much. I think that there's a very broad support. Great stuff. And I'm sure that as we go year by year, we'll fix them up. I think that even I picked up issues, but you know, we need to just get formal and get some things happening instead of trying to be perfect. So thank you all very much. So it looks to me like it's all supported, and that we are off to a great start in the setting up of the AfroPHC as an organization. I think we now have to just do the first task, which is to elect the new executive board. If you can, please put up your hand if you are a candidate. And then we will basically look at you by your surname and then give you the ability to speak. So okay, let me just mute. Yeah, okay, I think that's fine. So we will get each candidate. I think how Champion, do you want you need to leave, Champion?
Yes, yes.
Okay, let's excuse you and thank you very much. Champion has apologized for not standing. I think he's leading an organization that is Pan-African and a considerable exercise in itself. But thank you, Champion, for all the work that you've done with us, and we hope that you'll still be part of the mix of leadership as we're going along.
Absolutely, absolutely. And all the best for the rest of the meeting, and good luck to all the candidates.
Thank you very much.
Bye-bye.
Bye-bye. So each candidate, I think if you would like to manage this process with me, Innocent, we basically will go through them, and I will try to unmute you, give you a minute, introduce yourself. I'll try to share the website so that we can get to see also your picture and get a bit more. So if you just give me 2 seconds, and we will share that. Okay, where we have this list of nominations. So I'm going to just look for the participant, and then we are going to try and find the person. I think I'm going to have lots of challenges. We're going to have to try and do this on the basis of the people who are popping up on my screen. And so that's going to be the easiest. So let me just start with that. So whoever is present and has raised their hand will get their chance to speak, and we will just go to their website. So Nandili Isepe, Nandili is Mary Nandili. So Mary, I'm just going to give you the podium, and we will try to keep strict count on this. Innocent, do you want to keep time on this?
Thank you.
I will do that, but just don't know how to stop them in case they exceed the time.
All right.
Hello.
I will just give a warning, maybe.
Yeah, just a warning, and I will try and stop them a few seconds after that.
Okay.
Thank you. Go ahead, Mary.
Thank you, everyone. And good afternoon, morning, and good evening. I'm Dr. Isepe Nandili, registered nurse midwife. I hold a PhD degree in public health. Currently, I'm the Director of Nursing and Midwifery Services, Ministry of Health, Kenya, and I also possess over 15 years of experience in management. As a member of AfroPHC, my aim of driving it forward, they should be need to replicate best practices from other countries as well. And therefore we can engage other members from other countries so that we can also learn from them. Put together strong policies and strategies to govern the PHC agenda forward. That is quite necessary, and also involvement of stakeholders like the civil society organizations, community-based organizations, faith-based organizations to support move PHC forward, especially in rural and vulnerable populations. Considering also that CBOs or those key stakeholders, most of them are concentrated in rural populations. Engage media to promote and advocate PHC agenda to the needy. It's quite necessary. There is also need to maintain and promote health equity to ensure everyone at every given place accesses quality healthcare services. Thank you.
Thank you. I hope we haven't run over more than a minute. So thank you. If you can just remove your hand, and then Joan Karingiti, we can just go to Joan. Sorry, Joan, you can speak now. I think I've allowed you.
Okay. Hello, my name is Wambui Karingiti. I'm a young medic currently in Nairobi, Kenya, very eager to change the face of the healthcare system and in my society and Africa at large. Well, as we know, Africa's estimated population currently, we are at approximately 1.3 billion, and of which 40% live below poverty line. And now with this COVID-19, it has exacerbated these existing inequalities, especially in the healthcare system and the welfare of our people. So post-COVID-19, our countries need to be ready and to build back a primary healthcare system. And I believe AfroPHC is the solution. So if I'm elected as a member of the board, I'll ensure that we will strive to remodel PHC-centered healthcare systems, laying out ideal operational frameworks that will be suited for each country in order to achieve the universal health coverage that we are all aiming for and a health-related sustainable developmental goal. So I believe if we just work as a team, we will rise to a better Africa and a better tomorrow. Thank you.
Thank you. Well done for finishing short of the minute. Joan, you can just take your hand down. Thank you very much. Ella Musi. Sorry, Ella, now you can speak.
Thank you. I'm Ella Muche, a pharmacy student from Rwanda. I'm currently in charge of external relation in student exchange in Rwanda Pharmaceutical Student Association that I'm representing. When I'm given a chance, I want to make AfroPH be known by health students, starting from pharmacy students as my department. As I did the analysis, I found that in this AfroPH is made of mainly professionals. And I think that when you start with education with the student, the health will be more developed. So I want to be a bridge between health student and AfroPH. If you give me this chance, I will draw more health students into this AfroPH. So if you, according to the diversity, I hope you will vote for me so that even those students can know more about the health. Please put your trust in me. Thank you.
Thank you very much. We can go to the next. If you can put your hand down, Ella. The next person is Kwabena. Bongi, do you want to? All right, that's fine. Kwabena, I think, sorry, Ella, you are muted. Ephraim, I think I've given you the chance to speak. Ephraim Senkire.
Okay, thank you. Hi, everyone. I'm Ephraim Century, a registered nurse with Bachelor of Nursing in Pediatrics from Ghana. I have more than 5 years, 5 years clinical experience. I'm also a chair committee member for Alliance for Newborn Care and 2020 Together for Unity for Health Policy Fellow. I want to promote universal health coverage through primary health care locally by bringing more nurses on board, because without rural nursing workforce, rural healthcare will collapse and we cannot achieve Sustainable Development Goal 3. So this is my main focus. Thank you.
Thank you very much, Ephraim. You can put your hand down. Kwabena.
Yeah. Hello, my brothers and sisters. My name is Kwabena Hude, Executive Director of Health and Life International, a community-based NGO working in Ghana and Liberia, and I'm a management consultant. The conversations surrounding universal access to strong primary health care are never ending as long as we are not there yet. Recent crises, including the Ebola epidemic in West Africa, which by the grace of God I survived whilst in Liberia, have proven that. Although my background is technical engineering, I've contributed to these conversations academically, professionally, and practically for over 20 years of my professional life. I bring to the table the experiences gained and the lessons learned so far, and going forward, I'll be proffering practical and affordable solutions that will work. The executive board will give me the best platform and forum to achieve this objective. The vote for me on the board will take us closer to the point where we can say satisfactorily that we are succeeding in engineering the flow of primary health care so as to change the way we give and receive healthcare universally to achieving the best outcomes for every patient every time. Thank you very much.
Thank you very much, Ahude. Kwabena. Over to you, Radha.
Thank you very much. Can you hear me?
Yes, we can.
Hi, good afternoon, colleagues. My name is Dr. Radha Karnad. I'm a senior technical advisor for primary healthcare. I work for JPIGO, which is an affiliate of Johns Hopkins University, and I'm based out of Kenya, and very proudly Kenyan. My real interest is in taking a lot of the global evidence and information that there is and looking to contextualize it to an African setting or to the variety of African settings that exist. I think it's time for us to stop looking at policy and really looking at how do we implement that to make sure that communities are directly touched. They have access not just to preventive, promotive, and curative care, but also rehabilitative and palliative. That is, far behind some of the work we've done in other areas of primary healthcare. I would like to see AfroPHC really address the question of what will it take us to succeed? How are we going to set a local agenda that helps us to achieve the SDGs, UHC 2030, etc. Thank you very much. And I really look forward to working with AfroPHC.
Thank you very much. I'm trying to manage. So, Firu, thank you to you. You can proceed. Firu, I hope you can speak, but
okay.
Your surname, I'm trying to look for you on the list. Firu.
Okay.
Just to this. Okay, there we are. To this.
Okay.
All right.
Okay. Hello, I'm Firu from Ethiopia. I'm working on the primary healthcare program in Addis Ababa of Ethiopia, and I have more than 10 years experience on the HIV and the other different primary healthcare programs. So if I have the board members of the AfroPHC, and I am experienced of this association in different associations in Ethiopia. So if I got the chances, I'm committed, and we achieve the programs and the plans of association of the AfroNest. And thank you.
Thank you very much. Sorry. Let me give over to James Oloyede. James.
Good morning and good afternoon, everyone. I'm Dr. James Oloyede, a nutrition and public health specialist. I'm currently working as a coordinator on the Family Health International in Nigeria. I retire as a director of community health and nutrition services in one of the states in Nigeria with over 15 years in management position. I'm also a registered member of the Environmental Regional Council of Nigeria and Society of Nigeria. I hold a PhD in public health. Joining the executive of AfroPHC, I will use my wealth of experience within the primary healthcare environment I've acquired over the year towards achieving universal health coverage agenda year 2030 through engagement of governance and leadership of health sector across Africa, through appropriate financing of healthcare via protection and health insurance, encouraging people-oriented services with the principle of leaving no one behind, and strengthening health system and security by initiating action towards preparedness and capacity building within primary healthcare. I believe that if I'm given the opportunity, I'll be able to make a difference and move AfroPHC forward towards achieving its laudable objective. Thank you.
Thank you. Thank you very much. Appreciate that. Ansuya, over to you.
Hi. Hi there, everybody. I'm
Good, can hear you. Go ahead.
Can you hear me? Thank you.
Yes.
I'm a dentist and a PhD graduate in pediatrics. I hold an honorary researcher position in the Department of Pediatrics and Child Health at Wits University in Johannesburg. So I'm the odd one here because I'm also in private practice, where I encounter so many individuals who cannot afford basic dental services. Now, oral diseases are amongst the most prevalent diseases globally. They share modifiable risk factors and pathophysiological pathways with NCDs, which we know are increasing at an alarming rate across Africa. However, unfortunately, a shared risk approach to research and healthcare delivery is not usually considered. So I'd like to bring my dental background to the party and to promote an interdisciplinary approach to primary healthcare research and delivery. Thank you.
Thank you very much, Ansuya. Over to you, Ibrahim Umar.
Thank you very much for the opportunity. I am Umar Ibrahim, with a bachelor's degree in nursing, master's in public health, and a PhD in global health governance, as well as in community health. Alongside several other academic qualifications, I have also worked in public sector, in private sector. I have also worked in the academics and the think tank institution, including NGO. I'm currently the Director of Health of our Social Development Initiative and also a lecturer in community medicine. So my aim of being on board Afro Primary Healthcare is to see that the objectives of the PhD is achieved. This objective, the two main objectives, the ideal primary care and universal healthcare coverage, and also the means of achieving them. What identify the means of achieving them is bring together in line or to bring together the principle of primary healthcare, the six working block and six essential block of health system strengthening of WHO, and also the stipulation of the Sustainable Development Goals number 3, especially 3.8 that talk of universal healthcare, and also goal 17 that talk of our partnerships with the stakeholders, with the international unit, and see that a framework is established to guide the implementation of the primary care across Africa. Because having sovereignty in mind, you cannot impose any country to do whatever. So you need through advocacy and systematic approach, we can be able to realize our goals. And also try to understand what went on in the Bamako initiative about the Almaty Declaration, Abuja Declaration, and the Sustainable Development, and try to create the gaps and then try to make a balance there to see that the primary care well positioned in Africa. Thank you so much.
Thank you. Sefluli Moyo, over to you.
Good day, everyone. My name is Sachule Moyo. I'm in South Africa, an environmental health practitioner registered with the Health Professions Council of South Africa. I hold a Master of Public Health qualification, and with 10 years working experience that I gained from the private and the public sector, and with the understanding of public health and primary health care, I am hoping to take AfroPHC forward by ensuring that Africa, with the involvement of the private public sector, address the issues of public health with agency guided by the WHO standard. Thank you.
Thank you very much. Sehlule? Onyebuchi, I think you can go.
Hi, everyone. My name is Mr. Onyebuchi Eloke. I'm a young and vibrant microbiologist, public health specialist, and healthcare management consultant in Abuja, Nigeria, with more than 15 years, both national and international experience on public health development programs. I have accepted to stand in this election because I believe in the core values and objective of establishing AfroPHC as a basic component to advance UHC in Africa. Because of the gaps noticed in quality healthcare within the PHC level, I am coming in as a young practitioner that wants to bring in my technical expertise to build the bridge between the young practitioners and the elders in this forum as a rationale to advance quality healthcare to the next level in Africa. As an advocate too, I hope I'll make this possible with the presence of my fellow team members. A vote for me is a vote for continuity of this wonderful. Thank you.
Thank you very much. Onyebuchi, thank you. Tolu, over to you. I think I've allowed you to speak.
Yes, thank you very much. Good afternoon, dear colleagues. My name is Tolu. I am a pharmacist by training, and I currently work in the global health advocacy space on non-communicable conditions. I have over 10 years of work experience as a pharmacist in Nigeria, and I believe my understanding of healthcare teams and the challenges of service users will be relevant to the good work that AfroPHC is already leading within the region. In my current role, I engage with the World Health Organization and other UN agencies, and I also engage with WHO governing bodies like the EB and the WHO, where issues of UHC and PHC are discussed extensively. Apart from this point, I'm also following some platforms such as the Coalition for Health Workforce and Allies Improving PHC. And these are groups of other stakeholders who are also discussing PHC at the global level. If given a chance to serve on the board of AfroPHC, I would leverage my engagement with these different stakeholders and partners at the global level to amplify the challenges we are facing as a region and identify opportunities for advocacy and accountability, not just with government, but with all stakeholders. Thank you very much.
Thank you for keeping time. Really appreciate that. I just want to remind everyone that we are going through all these different people and really amazing bunch of people, wide selection that you have. I have tried to make it easier. We have tried to make it easier by putting the ages. My apologies if I've got your age slightly wrong. I had to guess it from sometimes your secondary school education, but also your gender and a little bit of the detail that was there previously. Hopefully for you who are members trying to figure out who you select, it might be useful for you to just figure out a way to tick off what your selection is going to be. Please give everyone the opportunity to hear them out. I think, there may be gems of people that I hear. I really appreciate it. So thank you very much, Tolu. I will just lower your hand and we'll just get the next. Okay, so let me ask Olusegun Amo. Olusegun Amo.
Okay, thank you very much. Good day, everyone. Other protocols duly observed. I am Amaoluwaseun Paul. I'm from Nigeria. I'm a public health consultant and a project management professional. I'm one of the youngest African leaders who are committed to transformation of Africa in Africa. I'm vying for this position to be part of the 9-member executive board for AfroPHC. I hereby solicit for your vote to become a member of the 9-member executive board for AfroPHC. Vote for the change we desire in Africa to advocate for appropriate primary health care and universal health coverage. Vote for a vibrant man who has the capacity of bringing together the leadership of all healthcare workers at the core-face of African primary care. Vote for a man who will ensure we have a voice in policy on primary health care in Africa. Vote for a transparent leader who will work together with you to promote health infrastructure through advocacy and innovative digital health implementation. Vote for Amaoluwaseun Paul as we both take AfroPHC to the next level. Thank you so much. I love you.
Thank you. Over to Mohammed Bonbida. Thank you.
Yes, thank you. Good afternoon, everybody. I hope you can hear me.
Yes, we can. Thank you very much, Mohammed. Go ahead.
Yes, I am young and also very faith-based leader and also development consultant.
Mohammed, just
Currently,
come
I'm
closer
the
to your mic so we can hear you clearer.
Hello.
Yeah,
Hello,
come
can you
closer
hear
to
me
your
now?
mic. It's better. Just come closer and then we can hear you better. Go ahead.
Can you hear me now?
Yes, we can. Just go ahead.
Is it better now?
Yes, it is slightly better. Go ahead.
Yes, I'm saying I'm the West African coordinator for Faith to Action Network, a global network of faith-based organizations promoting health and well-being of people. And to bring everybody on board, we need faith-based organizations as well on board. And not leaving everyone behind means voting for me, because I have what it takes to bring faith-based organizations as well as traditional community on board to promote primary health care and also health in general. So thank you very much. Vote for me.
Thank you, Mohammed. Over to Olusegun. Olusegun actually spoken, so let me just. Abu Bakr Abu Bulbulia, go ahead. Abu Baker. Bulbulia. Okay, let's move on to Ida Moyo. Sorry, Ida, let me just allow you to talk. Ida? Abu Bakr, are you able to speak?
Yes, I am.
All right, can you proceed?
Can you hear me?
Yes, go ahead.
Thank you for this opportunity. My name is Dr. Bulbulia. I'm an ophthalmologist and optometrist practicing in a semi-rural area in the northwest region of South Africa in a town called Mafeking. My concern is that primary eye care over the years has often been neglected in the broader context of primary healthcare. I believe that my dual professional registration as both an optometrist and an ophthalmologist, and my 20 years of experience in eye health renders me in a unique position to help bridge these two professions and additionally allow us to look holistically at aiming to promote primary eye care, especially in rural and semi-rural environments. In addition, my experience of practicing in a semi-rural area of South Africa for the past 10 years has given me greater insight into not only the social determinants of eye diseases, but also appreciate the huge impact of the burden of blindness, especially in vulnerable populations. I have a special interest in the epidemiology of eye disease. I would be honored to be part of AfroPHC, especially in addressing the future needs in the field of primary eye care. Thank you.
Thank you very much, Mohammed Abu Bakr. Over to you, Ida. Have I allowed you to speak, Ida?
Hi, good afternoon, everyone.
Go ahead.
My name is Dr. Ida Moyo. I'm from Zim. I'm a holder of a PhD in health studies. I'm an experienced advanced nurse practitioner with vast experience in the public health sector in the NGO world. I work for Population Services International in Zimbabwe as an integrated HIV services specialist. I'm also a part-time lecturer with Zimbabwe Open University Nursing School. To take AfroPHC forward, I'll be lobbying with the policymakers in the country to support the project. I'll also actively popularize the AfroPHC project.
Sorry, we seem to have lost Ida. All right. Let's go to the next person. We'll give Ida a chance to finish. Didn't quite get a minute. Al-Mughira Abdullah.
Hello, are you hearing me now?
Yes, I can hear you now, Abdullah. Go ahead.
I'm Dr. Al-Mughira Abdullah. I'm a public health specialist or community medicine specialist with over 15 years experience in healthcare management, especially in the area of primary healthcare, in many aspects like quality, efficiency measurement, and equity. Most of my career within health insurance, healthcare financing, and also I'm lecturer in many medical institutions in Sudan, teaching subjects related to public health in primary healthcare, especially the healthcare financing and so on. Also, I have many platforms, nationally and internationally, like Joint Learning Network and technical groups of health economists in WHO. I think the primary healthcare is the gate for all agenda or all goals that we are seeking for. So I'm very, very, very interested in this area. Most of my researches were done in primary healthcare, especially in my postgraduate diploma in MSCC, also in healthcare management and health economics, and also in MD. The topic, yeah. So if being elected, I will exert more effort with my colleagues in achieving the agenda, like leaving no one behind in our beloved continent, Africa, and we will move forward the PHC agenda on the in the top agenda of African leaders and decision makers. Thank you.
Thank you. Now let's go to the next person. Sorry. Paulo, you able to speak? Paulo Perez.
Hello.
Yes, can hear you, Paulo. Go ahead.
Okay, I'm a general practitioner, a consultant in general practice and family medicine. I've been working in primary health care for 36 years in several countries. And for the last 14 years, I've been working in Mozambique. So this is a Portuguese speaking country. In Africa, we have like 70 million people in Mozambique, Angola, Guinea, Namibia, South Africa, speaking Portuguese. So for the last 10 years, I've been also lecturing the medical students, and I've been introducing family medicine contents in the graduation period. And I've also been doing a lot of research in primary health care in rural under-resourced populations. So my main lines of action in Afro primary health care would be to structure the participation of traditional healers and traditional birth attendants to go towards universal health care. So here in Mozambique.
Thank you, Paulo.
Okay.
Go ahead. No, thank you very much. Appreciate that that introduction. So let's go to Pamela. Oh, thank you very much. Pamela? Pamela or Pepo? Pamela, you can... Pamela? Okay, while Pamela figures it out, we'll go to Ashok. Ashok, you can speak. Ashok Pandey. Ashok, go ahead.
Yes, hello all. It's me, Ashok Pandey from Kathmandu, Nepal, working as a public health researcher for more than 10 years. And currently, I am also chairing Public Health Research Society Nepal on a pro bono basis. I'm a social activist of PSC with global comment, including Civil 20 on the issues of USC and PSC issues. My nomination for AfroPHC Executive Board is to raise the silent voice of inadequate funding on PSC. I will also raise the voice of PSC Africa from South Asia. I will focus on how to finish the unfinished agendas of PSC. Thank you.
Thank you very much. Pamela, if you're able to, we can give you a chance to speak. Pamela? Okay, Ruben, we can allow you to go next. Ruben.
Okay.
Marcus.
Thank you.
Yes, go ahead,
Thank you.
Ruben.
Thank you very much. I am Nas Ruben Marcus Zragi, the National President of the Nigerian University Nursing Student. I have diverse experience in the field of primary healthcare, and I have been working with as a young social media advocate with United Nations Development Fund for almost 2 years now, and it's still ongoing. And I'm still working in the same thematic area with education as vaccine, as well as a Rescue Health Initiative Africa. So I'm a registered nurse and registered nutritionist dietitian with over 70 certificates of training and as trainee and trainer, which are relevant and are of public health concern, and PHC, that's primary health care related, with over 10 years experience in management. This experience of mine will best be utilized to achieve the universal health coverage through AfroPHC by initiating the policymakers to adopt and make policy which can make primary health care easily accessible, and advocate, create awareness and sensitization among communities, and involve the community participant in achieving this goal, because education is one of the essential tools in achieving universal health coverage. So if given chance to be part of this non-executive, I will be glad to do that. Thank you.
Thank you very much, Ruben. Pamela, if you are able to speak, I think you are unmuted. Pamela, you can go ahead.
Hello.
Yes, we can hear you now,
Am I
Pamela,
audible
so
now?
go ahead. Yes, you are. Can you hear me?
Oh, okay. My name is
All right,
Pamela Nyango Pepo. I'm a Kenya
Go
trained.
ahead.
I'm a Kenya trained community health nurse working for the government of Kenya. I'm really glad and grateful the one we've been waiting for so long. I've presented myself for elections to the executive board, and if successfully elected, I will join the already dedicated team that will work together to help drive the AfroPHC agenda forward, pegging my belief that a well-represented and expected healthcare worker at the public care centers is one who can deliver on the UHC agenda. And the UHC agenda, we are looking at a promise of health for all by the year 2030. And this health for all cannot be achieved without looking at the forces back at the primary healthcare centers. I'm looking at the nurse, I'm looking at the lab technician, I'm looking at the pharmacists at the community level hospitals, and I'm seeing most of them sometimes neglected kind of knowledge or capacity building. And you find most of specialists, they are in the major hospitals, so there's no downward movement of knowledge. So if elected, I'm going to...
Go ahead. You can close.
Okay, I'm just glad because I know we are going to achieve it with the AfroPHC, which has the greatest force to move that agenda forward. Thank you very much.
Thank you, Pamela. Our next speaker is Tijani. Tijani, you should be able to speak. Tijani, if you can unmute yourself, you'll be able to speak. And then we can give you a minute. Okay, seeing that Tijani is challenged, let me ask Marie-Claire Wangari to go ahead.
I'm Dr. Tijani Oseni. I'm a consultant family physician from Nigeria. I'm currently the head of Department of Family Medicine at Ambrose Ali University in Eboma, Nigeria. I've also worked with the WONCA African region for about 6 years. I've been with the AfroOne group, the youth arm of WONCA. I've also been following the AfroPHC for over a year now. I am passionate about moving the primary healthcare forward in Nigeria and Africa in general, and I believe AfroPHC will provide the enabling platform for that. If elected into the executive committee, I will work with other relevant stakeholders in the region to move primary healthcare forward, because I believe that the goal to achieving universal health coverage is focused on primary healthcare. So if given the opportunity, I will work to that direction. Thank you very much.
Thank you very much, Tijani. Appreciate that. So let me ask Marie-Claire to go ahead. Marie-Claire, you should be able to speak. If you unmute yourself, then I can start your minute.
Thank you so much. My name is Marie-Claire Wangari. I am a junior doctor based in Kenya, and I have been part of several youth-led organizations, mainly from university level to date. I'm also the co-founder and advisor to the African Healthcare Student Summit, which is a forum which is trying to unite all healthcare students in the Africa region towards being better advocates for universal health coverage. And I'm also a board member at the SRHR Africa Trust. For me, my main objective, if elected into the AfroPHC Executive Board, is to promote the advocacy and the implementation of primary healthcare at not only community level, but through various youth-led organizations, and to have youth as the pillar of our organization championing for various activities. As we all know, youth are majority of the population in our African region. And I aim to do this working in partnership with various youth-led organizations that are doing great work in our region, such as the IFMSA, IPSF, PAMSA, and among others, who we work with in collaboration with the Africa Healthcare Students Summit. And also, in addition to that, it's also to advocate for the more policies in primary healthcare and how youth can be able to implement these policies at their various backgrounds. Thank you very much. And I look forward to your support.
Great. Thank you very much. Appreciate that. Sorry. Natasha, I think you can speak. Natasha Kamisa. If you can unmute yourself. Kamisa. Natasha, go ahead. I think you're unmuted, Natasha. All right. While Natasha's getting figured out, let me go to Aziz Raleigh. Aziz, you can go ahead.
Go ahead, bonjour, Aziz. Je vais parler en français en tant que Marocain. Je me présente. Je suis Aziz Raleigh, docteur en pharmacie, avec 25 ans d'expérience. Un PhD de l'économie de la santé. En être élu, je suis fondateur des PHM, People's Health Movement, et en même temps, je suis coordinateur du Forum social mondial de la santé et la sécurité sociale. Donc, si je suis élu dans le board, je pense que je peux apporter cette expérience, qui est plus que 20 ans dans les associations à caractère international. De même, je suis membre du Conseil international du Forum social mondial. Donc, ce sera une opportunité de promouvoir les soins de santé primaires et d'apporter mon expérience, surtout que j'ai vu aujourd'hui beaucoup de jeunes africains enthousiastes et qui veulent apporter beaucoup de choses à notre continent. Si je serai élu, je mettrai toute mon expérience à la disposition de ces jeunes-là. Et merci à vous.
Merci, Raleigh. I'm hoping that you've been able to get translations and that the same has worked for those French and Portuguese. So thank you for that. Aziz, sorry, let me just quickly, Aziz, yeah. Let me just disable that. Natasha, are you able to speak? Natasha? Kamisa? Natasha? Okay, Cecilia Ndongo.
Good afternoon, everyone. Good afternoon, everyone. My name is Cecilia Ndongo, a nurse by profession. I bring to you a young and professional healthcare provider. When selected to the board member, I'd like to scale up what we have started in Kenya. We piloted the UHC in Kenya, and I happen to be the youth representation for the UHC stakeholders meeting. And so it was quite a success, and I'd like to be involved more to be able to accelerate the UHC in Africa, and also to I'd also like to get involved together, incorporate the CSO, that is the civil society organizations, to be able to promote health, so as our focus may not be mostly on curing, but we look first on the promotion of health, and also bring I'm also skilled with IT, nurse with IT. I'd also like to bring solutions for Africa. How can we scale up solutions in healthcare for Africa? I believe that when I'm part of the board as a youth, I'll bring unity for purpose, and together we'll be able to achieve the sustainable development goals towards the Vision 2030. Thank you.
Thank you. Thank you very much. Natasha, I think you're trying. If you can.
I am trying. Can you hear me now?
Yes, we can. Go ahead.
Oh, brilliant. Excellent. Thank you so much. So, Jambo, Mohoroi, Kemcho, namaste, and a good afternoon to you all. My name is Dr. Natasha Kamisa, and I'm a passionate young academic and researcher with a global footprint. My work is focused on caring for our caregivers with an emphasis on mental health and well-being of health workers in South Africa. Our health workers are the heart of a health system, and preserving their health is integral to providing quality healthcare. I can contribute global experience, expertise, and diversity to AfroPHC with my background in nursing, psychology, as well as public health. Challenging existing narratives is something I feel very strongly about, and I'm hopeful for an opportunity to do just that together with all of you. Thank you for listening.
Thank you very much. Appreciate that, Natasha. Cecilia, over to you. We've just got a few left. I think we'll probably be finished in the next 5-10 minutes. So Cecilia, you've already presented, so let's just remove that. Cynthia is next, Cynthia Taylor. Go ahead, Cynthia. I think you should be able to speak. Sorry, Cynthia. Taylor. There we go. Over to you, Cynthia.
Okay, greetings to you all. I'm Cynthia Taylor from Zimbabwe, and I work for the National University of Science and Technology as a senior lecturer in the Department of Nursing and Midwifery Sciences. I'm a nurse, midwife, and I've upgraded myself to an advanced practice nurse with a PhD, and I have an expertise in maternal, newborn, neonatal, and child health, as well as adolescents. And I have 40 years of experience in all the levels of the healthcare, in the healthcare delivery system. If co-opted into this AfroPHC forum, I'm very certain that with the wealth of experience that I have, I'll be able to contribute meaningfully towards the strengthening of the AfroPHC programs in the country and beyond. And we are aware that the majority of the populations are in the rural health centers, and our approach is the primary health care framework. Thank you.
Thank you, Cynthia. Appreciate that. Hassan Samlali. You should be able to speak, Hassan.
Oui, bonjour.
Bonjour.
Bonjour tout le monde. Je suis le docteur Hassan Semlali, je suis spécialiste en santé publique et je suis consultant senior en santé publique et économie de la santé. J'ai une expérience de 32 ans, durant laquelle j'ai servi 30 ans au niveau du ministère de la Santé et je suis actuellement consultant à titre privé. J'ai servi pendant les 30 ans, j'ai servi 12 ans en tant que médecin praticien et chef de circonscription sanitaire pour les soins de santé primaires qui desservait une population de 180 000 habitants. Et après ces 12 ans, j'ai occupé des postes de responsabilité, que ce soit au niveau d'une province sanitaire ou bien que ce soit au niveau de l'administration centrale. Le dernier poste que j'ai occupé, j'étais le chef de division de la mise en place de la couverture médicale des pauvres au Maroc. Alors, quel serait mon apport pour notre future communauté si je suis élu au conseil exécutif? D'abord, c'est le renforcement de notre communauté en la mettant en connexion avec d'autres communautés qui ont une portée continentale ou internationale, auxquelles je suis membre actif. Aussi, je partage mon expérience avec les membres de notre communauté, le développement d'un réseau continental d'experts en santé publique appartenant à l'Afrique pour servir en appui au système de santé africain, et Dieu sait qu'il y a un grand besoin à ce niveau-là. Contribuer également à l'organisation de symposiums africains pour les questions relatives à la santé, et notamment pour les soins de santé primaires, et surtout veiller à la crédibilité de notre communauté et à la reddition des comptes pour drainer des fonds et pour une reconnaissance et un positionnement international de notre communauté. Je vous remercie.
Merci, merci. Thank you, Hassan. We'll go to Silas Kipkene. Sorry, Silas. Okay, Silas, I think, can you unmute yourself? While Silas is getting fixed up, let's give Simon Shabangu. He's the last person to speak. Silas. Okay, there are others as well. Thank you for picking up your hand. Go ahead.
No.
So, all candidates, if you have not spoken, please use the opportunity to speak. Go ahead, Simon.
Hello?
Go ahead, Simon.
Hello?
We can hear you.
Can you hear me?
Yes, we can.
Okay, thank you very much. Good afternoon, everyone. My name is Simon Shabangu. I'm a dietitian by profession. I've worked at hospital, I've worked at clinic, and I was interested in joining the AfroPHC because I think that nutrition is more neglected when it comes to prevention. And I believe that if they can select me, I can improve the nutrition part since the COVID-19 has messed up everything. And most of the people that are affected are people that are overweight or obese. So with nutrition being involved, it reduce most of the case fatality. And I believe that I have the experience and the knowledge that I can help them, the group to move forward. And I want us to be like any other organization, like our UN and World Health Organization. Thank you.
Thank you very much, Simon. Really appreciate the brevity of that. Give me a second. So Simon, thank you. Let me just quickly mute you. And Silas, are you able to speak? Yes, go ahead, Silas.
Yes, thank you so much. I'm Silas Kipkene from Kenya. I'm working with a project known as Deliverance Church Care Development Program in Nakuru County. I am a graduate from Kenyatta University, studied population health professional. I will bring my comprehensive set of skills to this executive group of PHC. In my role of project officer, I have abilities in project implementation expenditure, proposal writing, training and administrative support. What I will bring to the executive team is that I will ensure that there is good leadership across all workers in Africa. Also, I will ensure that there is good formulation of policies and implementation to ensure that PHC implementation is going on very well. Also, to ensure that there is PHC service delivery policies and guidelines that is well documented across the Africa. Thank you so much for this opportunity. I will welcome your thoughts.
Thank you. So Silas, thank you very much. I think we basically have got a few people still left. Please let me just advise anybody who is not on the list of the nominations on the candidate list that I'm pointing to here. We will not be able to take any of you speaking. I'm not sure about Beauty John Ledge Dube, but the Ann Moses, I think unfortunately it was too late. So let me just allow, there are 3, and please don't rush to make votes. There are still 3 other people amongst the panelists here that need to introduce themselves. So there's still about 4 people still left. So over to you, Bosede Olaniyan. Go ahead.
Hello, good afternoon, everybody. I'm Bosede Olaniyan, a nurse by profession, one of the Nigerian representatives of Nursing Now World Health Association, and an award-winning nurse, striving towards achieving health for all and making a positive global impact. One of the things I'm interested in AfroPHC because I believe I have the knowledge and skills of what it takes to make health for all a reality. And by making healthcare services affordable, accessible, and available at all times. As we all know that there are five essential functioning that we all know that a high quality primary healthcare fulfills 5 essential functions. That is first contact accessibility, continuity, comprehensiveness, coordination, and person-centeredness. This and more I will do to take AfroPHC forward. So help me God. Thank you very much. Thank you for listening. And I believe I'm going to use my ability of advocacy to advocate for our people and make health for all achievable. Thank you very much.
Thank you. Bosedi is, then we've got Jeshni, who's last on this list, and then 3 other people. Can I please request, some people have not put their hands up, but they have not had a chance to speak. I know Joseph Anna is not, so if you have not had your opportunity to speak, please do speak. I think everyone wants to see and hear you, at least hear you. So please go ahead. Bosedi, thank you very much. Jeshni, you can go ahead.
Thank you, Professor Musa. I'm Jeshni Amblin-Elmer. I trained in South Africa as a nurse, but I've been working as a lecturer in the UK for the past 20 years. One of my roles is I'm the President-elect of the Royal Society of Medicine, the General Practice and Primary Care section, the first in its 200-year history. And I'm hoping that my extensive experience as an educator in primary care, because I'm involved in training pharmacists, paramedics, nurses, to really fill the gap in primary care to replace where we don't have physicians. I'm hoping that as part of the board, we can collaborate with the UK, because I'm also part of an NGO providing free healthcare services in developing countries. We're looking at development of educational opportunities to streamline education in Africa so that it aligns with what we are doing internationally. Thank you for this opportunity.
Thank you very much for stepping forward. Let's go to Abdullahi Suleiman.
Hello, can you hear me?
Yes, we can. Go ahead. Yes.
Yes, I appreciate the opportunity given to me to introduce myself today. My name is Abdullahi Suleiman, a nurse in Nigeria, an advocate for patient and quality healthcare for all. I'm also a member of African Nurses and Midwife Network. So if nominated as executive member of African Forum for Primary Healthcare, my interest is to promote networking, connection with fellow Health African and young professionals for future collaboration to make global impact. 2, to educate society and patients to get quality evidence-based healthcare they deserve. Thank you for listening.
Thank you, Abdullahi. So we've got Francois. I think you're able to speak. Francois, go ahead.
Good afternoon, everyone. My name is Francois from Cameroon. The president of Family Health and Development Foundation and a grassroots community-oriented organization. If I'm elected in this post, I will involve a lot of civil society organizations in order to promote primary health care in our context. We need a lot of experience to move primary health care in our context in this country, And so I think it will be a good opportunity for me to have a very good platform to bring its work in my country. Thank you very much.
Thank you very much, Francois Injejo. So I think last but not least, we need to move across to those who have been quite central to the whole AfroPHC effort. I'll go last, but let me start with Innocent Besije, and then Bongi Sibanda. And if there are any other people
Hi,
on the...
all.
Hi, go ahead, Innocent.
Yes, hi all. I am Innocent Besije. I'm a family physician and a lecturer at Makerere University, Kampala, here in Uganda. I actually began the AfroPHC together with the Professor Shabil, and my task has been to get together the member organizations of WONCA, which is the World Organization of Family Doctors, the African chapter, to support the works of AfroPHC. And here I serve as the General Secretary of the Association of the Family Physicians of Uganda, but I also work as the Executive Committee member for the Prima FAMED, which is the Primary Care and Family Medicine Network that promotes the training of primary care providers. I'm also the Associate Editor for the African Journal of Primary Health Care and Family Medicine. And there are many other things I do, but I think for now, those will serve the purpose. And on AfroPHC, I will continue providing the linkage and leveraging with the work that I'm already doing with these international bodies, organizations, promoting the PHC, but also trying to promote documentation of AfroPHC activities in the form of scientific and scholarly publications. Thank you very much.
Thank you, Innocent. Appreciate that. Bongi Sibanda, last but not least.
Thank you. Greetings, colleague. It is my absolutely honor to be able to stand for the executive board here at AfroPHC. It's been an honor really being with the AfroPHC since 2019 and driving the advanced practice initiative, particularly with a focus on family nurse practitioners. As we go ahead with my work that is underpinned by interprofessional education and professional development, as well as educational policy, I would want to proceed with colleagues to strengthen health systems by building a health workforce that is fit for purpose, and also ensuring that we have policies that meet our own populations in Africa. I have already evidenced that through my work with WHO Afro, ensuring that for the first time we had APN policies that spoke to Africa. So it is my absolute honor to be proceeding this work with my colleagues. Thank you.
Thank you very much, Bongi. Appreciate that. I think we are at 3 o'clock and we hope to finish by this time. I do apologize, Moses Ahabwe and Beauty John Ledge Dube. Unfortunately, we're only allowing comments by candidates who've been successful in providing their, and let me just make sure that I've got everybody and we are not missing anybody. Please, if you are having a hand up, yes, I think we don't. Christine, yes, if you've not had a chance, Christine, go ahead. Anybody else who has not had a chance to speak, please feel free to raise your hand and we will try and give you this opportunity to speak. I know it's been a very tough time listening to 50 people presenting, but I hope you've got a very good idea of the people who are in front of you so that you can make the best choice. And thank you, Joseph, Anna, for stepping up. We really would like you to be there. So anybody who's missed, please step up and join us. Okay, go ahead. Go ahead, Christine.
Good afternoon, everyone. My name is Christine Yahama. I'm a lead CHV in Kakamega County, Kenya. Investing in CHVs ensures that healthcare is delivered on the doorsteps of those who need it most. As a CHV members, what we are doing, we are the first community entrant in the UHC. We are busy mobilizing and recruiting people for the NHIF. I'm a certificate holder in community health and development, and I'm also a zonal leader in Kakamega MNCH Alliance, and I'm also a member of PHM Kenya. If I'm given an opportunity to represent, to be a board member, I'll make sure that I stand for the CHVs who are the game changers in UHC. Thank you very much. God bless.
Thank you very much. And I think the diversity of people in the in this board is very important. So I'm really glad that Christina stepped up. Joseph, Anna.
Yes. Thank you very much, Prof, for the opportunity to speak. And good afternoon, everyone. My name is Professor Anna. I'm the lead senior fellow at the Africa Center for Clinical Governance based in Calabar, Nigeria. My interest in AfroPHC started from the first communication that I received from Professor Musa in August 2019. And the objective of strengthening the PHC delivery to achieve universal health coverage across Africa was very, very interesting to me because it aligns with what we've been trying to do in Nigeria and West Africa over the last 3 decades. I wish to be elected to this board because we'll be able to bring our wealth of experience to make AfroPHC the voice, the go-to place for opinions, views, and policy making for PHC in Africa. It is very important to do that because we want to do exactly what our colleagues in other continents have done. For instance, in Europe, they have the Euro Forum for PHC, and that is the voice, that's the go-to place for PHC in Europe. We need to be able to achieve that in Africa. And I think I have the skills and experience to work with my colleagues in the board and the wider membership of AfroPHC to get that achieved. It's important once AfroPHC achieves that to be able to move the needle forward. At the moment in Africa, UHC is focused mainly at the financial definition, which is very important to avoid catastrophic financial damage to people when they fall ill, but we need to move it beyond that. Once, for that to be work, the PHCs in Africa needs to be fit for purpose. They need to be manned by competent, empathic, and motivated health workers. And AfroPHC should be an advocate for moving that forward. If we do that, we'll be able to have PHC scaled up across the continent in an integrated and team-based way, people-centered and innovative to catch up with all the challenges that we face in running PHCs. I wish to be elected to this board to bring my wealth of experience. Thank you very much.
Thank you very much, Joseph. Okay. We have got comments that are coming. Sorry, I should mention I'm a candidate. I'm a family physician in Soweto. I'm the president of, oh, sorry, Zubero, I missed you, but we'll allow you to talk. So I'm a family physician. I'm the president of Wonka Africa, which is the World Organization of Family Doctors. And essentially, I've been sort of pushing the idea of this African Forum to try and bring teamwork to bear so that we work well. Moses, I will give you this opportunity just now, if you give me a second. So what we hope to do for AfroPHC is to really make it a strong voice for African primary care, especially people on the front line. People down there working very hard, they need their voices heard, and we need to make that heard. So let me just stop at that. I want to just give Zuberu Abdulhakim the opportunity to speak. Go ahead, Zuberu. Let me just quickly make sure I get your picture. Sorry, it's a little challenging with all of this. Zuberu, is that your surname? Go ahead, Zuberu.
Hello, good day to you all.
Yes, we can hear you. Go ahead.
I am by name Abdulhakim Zubairu.
We can hear you. Go ahead. Abdul Hakim Guberu, we can hear you, but you need to speak. I think you have some challenges. In the meanwhile, I'm not sure if Joseph, Christine, or Francois need to speak. If you do, just put up your hand. Otherwise, I'm going to just disable.
A registered nurse of professionalism. I give this.
So I think we're having challenges with Zuberu and his connection. We'll give him a chance to speak now. In the meanwhile, Moses, you have a comment to make, and my apologies. I've been trying to, I know you've sent your submission through, but it was a little too late, and we had to say no to lots of last-minute submissions. You can see it's been quite challenging to manage the number as it is. So go ahead, Moses. Any comments are welcome. Moses is not a candidate, but has requested a few comments.
No problem. Thank you so much, Professor Shabir. I know sometimes it's difficult. So I'm Dr. Moses Ahagwe. I'm a medical doctor in general practitioner, but with a public health specialization. Over 15 years in public health practice. So my intention to give my views here is just to see if what I can perceive as a AfroPHC can really look at what I'm looking at in terms of how do we want to address healthcare in Africa. So having been in many countries in Africa, looking at how primary healthcare is struggling, I feel we need to look at AfroPHC as a cornerstone that is going to help in improving healthcare standards and systems of operation in Africa. And this means if we have to have new ways of doing things, then we have to be innovative. And the new board or the elected representation needs to start thinking innovatively. How do we do things, and how can we tailor up these new innovations to the African way of doing things, rather than looking at things that are done in a routine way. Routines we have worked through, but much has not been achieved. So we need really to go beyond what we think can work. And I feel this PHC really needs to be a practice that is going to address the issues that we normally meet, which are always the availability of the right health workforce. What is the way of financing the healthcare services by these different governments, which are always not able to meet what they are expected to meet in terms of ensuring right healthcare provision in terms of funding. And then the standards. What are the standards that we are working with? Are we really setting standards that can help people to move forward? This is not actually a challenge to AfroPHC. I think even we need to look at WHO, maybe Afro, even WHO in general. How do we ensure that we have standards of working and which are going to be tailored to every level of any country in terms of economic capacities? So I don't think.
Thank you very much, Moses, and really appreciate those comments. I want to just quickly ask if there are any other candidates. I know there's one that has just come. Lisa Marie, please pick up your hand, and anyone else who's a candidate that has just arrived. And if you have not been able to speak, please let's use this few minutes opportunity for you to speak. Abdul Hakim Zuberu, I know you got cut off with your voice, so if you want to get this chance again to speak, if you are challenged, let's move over to Anil and then Lisa Marie. Go ahead, Lisa Marie, or Abdul Anil. Go ahead, Anil.
Yeah, good evening all. Am I audible?
Yes, we can hear you, Anil. Sorry, I'm trying to find your surname, other names.
I'm Anil Kumar, basically origin from India, and I'm working for the Saudi Arabia since 3 years as a director for the Ministry of Health. So I thank Mr. Shabir for the opportunity. For the PHC to now, this is like a pandemic, and now it is like we need more on the health awareness, and then for the child and health, nutrition, and then financial stability, and then more on the healthcare workers' knowledge to improve. So being an administrator in the nursing and then psychologist on the counseling basis with the two professional backgrounds, I put the knowledge and then awareness to the people on the child and health and then immunization and this community awareness to the people where there are the aspects that which will strengthen the communities to the safer health practices, which is now more important for us. So thank you, Mr. Shabir.
Thank you. Thank you for presenting yourself, Anil. And Abdul Hakim, I know you've been battling. You can have a last chance and to speak. Go ahead, Abdul Hakim Zubairu. I'm giving you some time again.
So I'm back. I am by name of Nigeria. Yeah, from Nigeria. From
Go
Nigeria.
ahead. We can hear you.
As a young nurse with lack of professionalism, I deem these points of mine necessary to play a vital role in taking African Forum for PHC forward. This include advocating for PHC comprehensively, effective communication and collaboration between the members, plan and implement a policy to address all issues related to PHC, giving adequate support and motivation to PHC activities, strengthening the PHC activities for the attainment of universal coverage, taking the principles of PHC into cognizance, like community participation and use of appropriate technology. With these points of mine, I hope we together make AfroPHC proud. Thank you very much.
Thank you, Zubairu. Sorry for the difficulties. Lisa Marie, I think you should be able to speak. Go ahead.
Yes. Can everyone hear me, Shabir?
Yes, we can hear you very well.
Thank you for the opportunity to speak and just to mention who I am. So I'm Lisa Marie Hugo van Dijk. I'm at the University of the Free State, and I'm also an AfroPen representative. I've been in primary healthcare for the past 10 plus years. I've worked internationally in Mozambique and Zambia and Zimbabwe, where I founded a mobile clinic called Care for Zumbu. So I have a lot of PHC experience, and I also have brilliant relationships with, or I had brilliant relationships with the healthcare professionals that I work with. And the interprofessional need in PHC is so much needed to really make a difference, especially when we look at universal health coverage and so on, and also quality patient care. So currently I'm a senior lecturer at the university, and I also accompany students in the clinical facilities, specifically PHC. So that's our second year undergraduate. And I think the next step, if I look at the strengthening PHC, is really to equip our undergraduates and also I think our postgraduates as well with the necessary skill set to serve our communities in PHC. So I have a qualification and a post-basic diploma in primary healthcare and also nursing education. So I think that is in a nutshell that I have to say about myself. Thank you for the opportunity.
Thank you very much, Lisa Marie, for standing and being supportive of us. And I think representing the AfroPen, a very important organization. In the absence of Champion, you are his substitute. So I hope that people will take cognizance of that. All right, well, we've come to the end of this. I think that we have, you have the opportunity to now vote. I think to complete the voting, you've had this really, I hope, a good opportunity to see and hear and look at everybody in detail. There is, I will share just briefly now the link in the group so that those of you who have not had the, sorry, I'm going to have to leave it to the meeting, to the email. So I'll send out the email once more, and we will leave it till later, till the end of the day today, so that any member can in fact then be voting and deciding on that vote. So thank you very much, all of you. I don't know if you have any comments, Innocent, how we should go forward. I think we have reached the end. And Lisa Marie, you are okay?
Yeah, I am okay here. I don't have any more comments. So.
All right. Lisa Marie, do you want to have any, you have any comment? I think you raised your hand again.
Yes.
Yep, go ahead. Go ahead.
Lower my hand. Sorry, Shabir, I was busy looking at the list and I started voting, but then mine, for instance, throwed me off. So is there a way to reset it maybe so that one can just go in and vote? Or is it already pulled through to a system?
If you've submitted it already, you would have to use, we'll have to just talk to it. So if you have had any incident like that, please email me and give me, and I'll have to try and delete the record. Or if you tell me of another email that you'll use, but once you submit, it won't allow you a second time. So just send me an email and I'll try and fix that up.
Oh, thank you. Sorry about that, eh?
No problem. I think other people might have the same challenge. I just want to answer one quick question, and then I think there are still some other candidates who'd like to speak. If you've spoken before, let's not speak again, if you don't mind. So Beauty, I think you asked the questions, are there any opportunities for recognized professional development? Yes, if you go to the website, there's some management training that is free at the moment. We are looking at CPD that will be freely available, but you'll get more details of that soon. I think more importantly right now, we're looking at how to develop material as well with the provider. And lots of opportunities, that have been pulled up and shown even now for taking things forward. So I hope that answers your question. I know you had your hand up earlier. Lisa Marie, I think you finished. I think Obatunde Oladapo, I think you are, no, you're not a candidate. Pamela, you've been a candidate, and Marcus. So go ahead if you can speak, but please, let's keep it brief. I think the numbers are going to drop very quickly, and we would like to terminate this meeting and allow people the rest of the afternoon. We will send the email once more to provide people a link to the voting. And if you have any difficulties, email me what your challenges are. We'll try and help you. Obatunde, you can go ahead and speak.
Yeah, thank you very much, Prof. I've been following the wide array of candidates that have been putting themselves up for election, and I must say that I'm quite impressed with the caliber of candidates. I'm also excited about AfroPHC coming forward because it's long overdue. My only concern is that it's looking more like a lab and stethoscope kind of coalition. We need to find ways of widening and spreading our drag nets to bring in other players in the field of community health. Beyond the professionals, we have people from the communities, civil society organizations, patients organizations, advocates, and other people that play, especially people that are lay workers and practitioners or stakeholders on the field. For example, in my organization, we work with a lot of women who are mentor mothers, who are not healthcare professionals, but they're doing a lot in raising demand for services in the communities and linking people from communities to facilities. And they all have a lot to contribute. I think we should start looking beyond the healthcare practitioners. Thank you very much.
No, thank you, Obatunde. I think that's a key comment, which is why when we had even a community health volunteer that stood for the board, I think that was very welcome. I think we need to have a diversity of people, and I think it's been good going from my view, from all stethoscopes a few months ago. So thank you for that comment, appreciate it. Pamela, you would like to comment? I'm going to keep you to time, so go ahead, Pamela. Sorry, Pamela, I didn't give you a chance to talk, so now you can speak. And I think just in terms of the comments, I think there's so many people around the table that have presented themselves, and even people who are just in the audience today. I think we don't want to leave anyone unused in this cause, and I think we just have to find clever ways to bring everybody in. And I think that this method of communicating has been very, very helpful. I'm going to say that we're closing by 3:30. So Pamela, if you don't have anything to say, Ruben, Pamela, do you want to say anything?
I have something to say, yeah.
All right, Pamela, go ahead. Go ahead.
Okay, this is just my parting shot on UHC.
Yes.
What I can summarize is that UHC is achievable. I work at a referral hospital, and it has been my concern. I've been wondering, why should we end up with amputations for, people with the diabetic wounds? Okay, my belief is that the first care that a patient receives at the primary healthcare facility is the one that decides the outcome of the disease. So if this initial presentation of the disease is managed at the primary care level, then we're not going to have disease complications in the referral facilities. I'm trying to imagine that even when the community is empowered, they know what to do so that they don't end up with the complications of diabetes. So the basic thing about UHC is empowering the community and empowering the people at the ground, the people working at the primary healthcare centers. That is the nurse, the team that works at the primary healthcare. So in that, we'll be avoiding this much complications about about diseases that can be preventable. I'm trying to imagine.
Thank you, Pamela. Sorry, I'm going to have to cut you off, and I think let's not have candidates speaking now. I think it'll be unfair to others who've spoken. So I'm going to just stop it there. I think there are some questions that have been raised. I think that there are many, many people around the table here who have been really great. I think just for those questions that are coming up now on the chat group, we are going to allow you to continue the voting till midnight tonight, Central African time, so that we don't prejudice anybody who feels they would like to fix their vote, re-vote, or whatever. Anybody who would like to change their vote, please, you'll have to send me an email, because the submission you've made, once you've done it, is you won't be able to get in again unless I try to delete that. We're going to have to keep very clear records of that problem. So please, because we want it to be something that is above board and that everybody is able to be trusting the outcome of this. So please understand that it is going to be something that we're not going to be able to do just like that. So please send your email. We're going to then try to see the problem and see how to assist you. So please know that we will delay. Is that a reasonable, I think, request that people get till, and I think the problem is that we are also in a challenge. I am going to see, you can vote for yourself, Mary, entirely your choice. With regards to the platform, I was hoping, in fact, using a system to be able to provide you a sense of the results, but I must be honest, I'm challenged to get that. We've already 133 people submitting votes, but I think it's challenging to see the results. Let me just see if I can get a report, and it might tell you something of the outcome. And you can see there is a spread of different people who've been elected. So I think you can see the mix already. I will try to share this report, but it is confidential until we validate it. So I think I could go through this very briefly. I'm not sure that I can provide you any more than just this information. So if you don't mind, just yeah. Let me just say that I unfortunately I can't tell you who's got exactly what number of votes, but you can see that people have been voting, and there is a sense of who the people are. We'll nonetheless send a link again to everyone through an email to make sure Reverend Michael Dandulakis, okay, I will give you that chance, seeing that you're a candidate. Reverend, do you mind just picking up your hand? Lift your hand so I can pick you up. Let me just see, Dandulakis. All right, there you are. You can speak quickly, and I think any other candidate who has not had the chance to speak, I'm going to give you this few seconds more. So, Reverend, go ahead. I think you are able to speak. We will terminate the elections by midnight tonight to give everyone a chance, and also to prevent, to allow everyone to fix up their votes if they have challenges with it. I can't promise that. So go ahead, Reverend.
Yeah, I'm a registered doctor for the last 39 years and qualified civil for the last 32 years. I am director in family medicine in the Greek NHS for the last 32 years. And I am the scientific coordinator of Health Center Bavaria in Attica for the last 9 years. I want to transfer my experience of organizing Health Center Bavaria according to the principles of health management and quality assurance to the Health Center of Kinshasa, where His Eminence Boris had appointed me to be responsible. Thank you very much, and congratulations again.
No, thank you very much, Reverend. We are at the end of our proceedings, so I think we don't have any more people who've got their hands up and who are candidates, so we're closing it here. So let me just say thank you all very much. I think that in terms of the results, we will share results by Thursday, because the results need to go to the core committee, which is managing this process. If they're happy with it, then we will try and provide you the formal results by Thursday at least, Thursday, Friday. So if you don't mind giving us till that time to just get these results, firstly for you to finish your voting by midnight tonight, Central Africa time, and then for us to get these results out by Thursday, Friday. With that, thank you all very much. Congratulations to all of you for being available to spend this time to help to launch. And I think we are going to see a lot of people being really very, very helpful in this process. Innocent, do you want to say some lasting comments as core committee members, Bongi and Innocent, and then we can close. Thank you. Thank you.
Thank you, Shabil. I think what I would like to mention last is that really I am very impressed by the enthusiasm. You know, we started this with a vision, but the journey wasn't clear. So at least with the enthusiasm that has been created, my hope and the sincere hope is that the people who will be elected on the executive board will really continue with the vision, and at least we should try and as much as we can to achieve the universal health coverage for Africa, given all the challenges that we face. And really together we shall achieve more. Thank you very much, Shabil, for organizing this, and we are supporting you, and we pledge our support, and we hope that together we shall improve the health of the African continent. Thank you all for spending their time to participate in this important event.
Thank you very much, Innocent. Bongi, do you have any closing comments?
So to thank all colleagues who have been able to join us today from across the globe, really. I mean, the vision of AfroPHC going forward really is to ensure that we have that balance of global South, global North collaborations that are meaningful and partnerships that are based on the needs of our populations. And to see that coming through today is really a reflection of the leadership that we have at AfroPHC. So thank you very much once more, Prof. Musa, for your exceptional leadership and for bringing key stakeholders of leaders across organizations together. And as usual, together we are going to see this go through, whether we are in the board or not. This is for us to take forward for our populations and our communities that we serve. Thank you.
No, thank you, Bongi, thank you, Innocent, and we want to thank the core committee that have been doing work behind the scenes for all their wonderful work to take it to this point. And we, in advance, congratulate the new executive board once we announce it Thursday, Friday. I think best to all of you, and thank you all for spending the time to be with us this afternoon and launching the AfroPHC. Take care, and we'll send an email shortly that will make all of the issues very clear for you. So please make sure you vote and be safe, be well. Take care. Bye-bye. And thank you to the translators. Appreciate their work, and we hope to get feedback from you if that worked out well. And really appreciate your work, Andrea and Alexandra. Thank you.